Joining us is our special newsmaker on the show tonight, and that is Dr. Devi Shetty, the chairman of Narayana Health. And of course, Dr. Devi Shetty also just been appointed the head of a task force by the Karnataka government for a possible third wave. Dr. Shetty, thanks for joining us tonight to give us your perspective. First, sir, you've actually been appointed the chairman of this new task force for this third wave. Now, is this third wave a certainty? It's good that the government is preparing for it, but we're still battling this killer second wave at this point. What do you think are the key decisions that need to be taken now, especially in Karnataka, which has the highest states numbers in the country?
First of all, I am not an epidemiologist, and I am in no position to predict whether there is going to be a third wave. But all I know from the experts is that there is a strong possibility of a third wave. Looking at what happened in US and Europe, virus has behaved the same manner, so we are likely to get the third wave. And there is a possibility that the third wave virus will predominantly target the children, mainly because adults are either infected or immunized. So COVID virus has to find a new host. And the most vulnerable group in large number are the children. So when I talk about children, let's talk about children less than 12-year-old. We have nearly 150, 160 million of them. So there is a serious problem. If at all, I hope and pray to God it doesn't happen. But if it happens, we shouldn't run around like what we are currently doing, because we never anticipated what the volume of patients. First of all, I just want to put it in record that the current problem of numbers of patients, no country in the world can manage. Even England and US together can't manage. This is unmanageable number. Let's be very realistic. And government has done a phenomenal job in certain areas like oxygen distribution. I have gone through the entire detail. They have moved heaven and earth to ensure that oxygen reaches. So it is not that somebody is at fault. What is important is we have done a good job, fine, it may not be the best job. Let's prepare ourselves for the next wave in a manner that everything is done properly so that we don't have any surprises. That's the whole purpose of my writing this article and trying to encourage the policymakers to go in this direction.
So, Dr. Shetty, because in fact, you gave some very valuable suggestions last week as well when you talked about how you could use MBBS students. We know the government has already made some advance in that area. And you're talking about looking at young children. And of course, as the mother of a young child, that really is so worrying to hear. What are the top 3 recommendations that you would say for looking at the third wave? And then we could talk a bit about the current situation in Karnataka. What are your top 3 recommendations on what we need to do?
For the next wave, it is very, very important that we vaccinate all the young fathers and mothers. All the parents must be vaccinated within the next 3 months' time. So why they should be vaccinated? They must be vaccinated because if the parents are vaccinated, the chances of kids getting COVID is very, very less, hopefully. God forbid if they get infected. You must realize that managing children with COVID in the ICU is dramatically different than managing adults. Adults take care of themselves most of the time as long as they get the oxygen. Children cannot be left alone with the nurses and doctors. We have very few nurses in the COVID ICU, especially at night. And these kids are not sedated. Kids who had a heart operation, we sedate them. Whereas these kids cannot be sedated, they need to breathe. And when they are restless with low oxygen, they will throw the mask. Now, continuously 24 hours for a few days, nobody can manage these kids other than the parents. Now, it is very, very unfair to push a lady or a man whose father or mother of 3-4 children to a COVID ICU without vaccination.
Right.
And vaccination takes time. Because you take the first dose, even if you take it the second wave, a second dose after 6 weeks, it takes at least 2 more weeks to get the antibody. So it is very, very important that we are aware of this problem and we should be preparing the parents to get into the ICU if required. God willing, it shouldn't happen. But if it happens, what are you going to do?
And you made that point that even paracetamol and even children's medicines need to be manufactured now in bulk so we won't see a shortage of, like we did with remdesivir and other medicines?
It is going to happen. You just need 500,000 kids to fall sick and fever. That's it. The medicine will disappear. Because you must realize that these stocks are made on the current requirement. And you can't straight away in few days ramp up the production. Not only that, the oxygen mask, oxygen hood, I just want to let you know that children are not miniature version of adults. Whatever you have done with the adults, you can't do it with the children. And more than anything else, the biggest problem is going to be shortage of nurses and doctors. See, in adult COVID ICU, at night there may be 20, 30 patients, and in some hospitals there are hardly 4 or 5 nurses managing this many patients. Because patients manage themselves. Whereas if there is a kid, there is a mother or father, they will be constantly demanding, and with 3 or 4 nurses with 20, 25 patients, they can't. They want good attention.
Of course.
So we have to produce few million doctors and nurses right away who are not working inside the hospital.
And you've said that we should create an army actually of doctors and nurses who we can prepare for the third wave. But just to point out, Dr. Shetty, you stressed out the need for vaccination. You've talked earlier about how the 20 to 45 year age group can be super spreaders. But the fact remains that currently we are battling a shortage of vaccines. We've seen different states are now issuing global tenders. So the virus is going to outpace what our vaccination requirements seem to be. And one very sad aspect of the second wave has been that we've seen so many young parents dying, breadwinners of families. We've seen a father and a mother die, leaving a child orphaned. What do you think have been the biggest differences? Because you've, of course, been in the hospital both in the first and second wave. What have been the biggest differences you've seen in the second wave, and what must be the biggest learning from this?
The first wave attacked primarily the elderly with comorbid condition. It spared the young breadwinners of the family. And second wave, large number of breadwinners of the family are affected. So the virus keeps changing its approach. So we should have a dynamic approach, and the next vulnerable group are children. So that's the reason why I strongly feel, along with many other experts, that we should be prepared. If it happens, we are prepared. If it doesn't happen, we should thank God it didn't happen.
Exactly. Do you feel, but Dr. Shetty, we've just seen the announcement that vaccine gaps will be increased, almost doubled in fact. From earlier it was 6 to 8 weeks, now it's become 12 to 16 weeks for Covishield. Do you think that this is scientifically valid? As a doctor, do you think these gaps are a good thing, that we give more people the first dose? What would you say on vaccination? What would be your advice be to policymakers and the government now?
I do not like to comment on areas where I have no expertise, Sonia. I'm sorry, I wouldn't be able to say anything. Yeah.
Well, you're a rare person to actually express that, Dr. Shetty, but thank you so much for sharing your areas of expertise with us. And I remember you working with so many pediatric heart patients through your career, and I think it's really wonderful that you're focusing for now the Karnataka task force on what should happen. I hope everyone is listening to what you're saying tonight. Thank you, Dr. Devi Shetty.